Can you guys see the next slide?
Yes.
Okay, yeah. So this is the next question now. Development time indicated for film processing in the developer with a temperature of 80 degree Fahrenheit is. Now this is a question which is actually depending on a method called as time temperature method. Have you guys heard of this time temperature method? Well, a time temperature method actually depends on, or actually is done in which generally in our colleges or in our places we generally take, what we do is we take a radiographic film, see input it in the processing solution, and then we see the pulp chamber, and that method it is called as visual method. The other method that is more commonly used is called as time temperature method, in which we measure the temperature of the developing solutions and the processing solutions, and we place a radiographic film into that processing solution according to the temperature. Okay, is it clear? So in that ways, so this is the generally the temperature which you need to remember. At 68 degrees of Fahrenheit, the amount of time in which you place the film is approximately 5 minutes, which gradually, just remember one thing, the moment you add 2 degrees, you reduce the temperature by half a minute. So at 68 it becomes 5 minutes, 74 and a half, 72 4, 76 3. The only difference is between 76 and 80, instead of you would expect 2, it is 2.5 minutes. Okay, is it clear? So just remember one value, 68 degrees 5 minutes, and then just make a mental calculation. For every 2 degree fall, you are reducing temperature by half a minute. You are reducing the time by half a minute. Is it clear? So this is how a processing tank appears as. I told you what is the size of a processing tank. It is roughly 8 into 10 inches. The roughly size is 8 into 10 inches is the size of the processing tank, which you guys need to remember. Okay. And well, I told you we measure the temperature of the processing solution. Well, how do we tell it? The way, same way which we do and measure body temperature, that is by using thermometer. But this is a slightly different thermometer. In this thermometer, instead of mercury, it contains alcohol or metal. Why do we require a special thermometer? Simply because if we use the established one thermometer that contains mercury, it tends to react with the developing solution, causes spillage of mercury, and ultimately not only causing it toxicity, it also contaminates the solution. Is it clear till here? Okay. So this is the next question now. Yellow or brown spots stains seen in the radiograph are seen due to. What is the most common cause of the yellow or the brown spots? Probably you would have seen it during your UG time, in which you would have seen a radiograph that has been old starts showing yellow or brown stains. So what do you think would be the probable reason out of all these 6? Take your time. Is it depleted developer? Remember, only depleted solutions, whether they are developer or whether they are fixer, would ultimately result in an improper quality, and ultimately they would cause yellow or brown spots. So 1 and 2 are absolutely correct. So what is the next choice? Third, double exposure. In double exposure, will brown spots occur? There is no reason for them to occur, isn't it? What about the fourth choice? Excessive time in wash water.
Sufficient one.
You think it's a good thing or a bad thing? It is in fact a good thing. So when you are placing it for an excessive time, what you are doing is you are actually ensuring that there are no brown spots. So whenever you do insufficient washing, there is a chance of brown spot. Okay, so choice 6 is also correct. So what about choice 5? It is absolutely correct. Whenever any kind of solution, whether it is developer or fixer, it gets contaminated with any XYZ reason, it ultimately results in the production of yellow or brown spots. Okay, so the answer is 1, 2, 5 and 6 or choice F. Is it clear? Well, this is yellow or brown spots on radiograph. What do you think this is spot? Which spot is this? This is an example of a light spot. Can you make out this? So can you guys tell me what is the main reason of a light spot? When the X-ray film, just listen carefully, when you place an X-ray film and you are placing it in a dark room, and instead of first placing it in the processing tank, you take it on a table, place it on the table, but on the table there are some spillage of fixer solution is there. So what happens is the film comes in contact with those spillage fixer solutions, and when you process it completely in developer or fixer, that light spot will come because it came in contact with the film with fixer prior to processing. Is it clear? What if you had spilled a developer? Then what would have happened? Then instead of light spot, you would have landed up with a dark spot. No, dark spot. See, this is the one very common mistake which almost everybody does it. Light spots and light films are different, and dark spots and dark films are different. A light film means the film is uniformly light in image, whereas a dark film means it is uniformly dark in color. There is a light in only a particular area, like in that way, in this particular slide. Can you see this? This is an example of a light spot. Okay, and a dark spot would be completely opposite of it, in which you see a blackish area of radiolucency which is seen in it. So a light spot is generally caused by film that contacts with another fixer, and a dark spot comes in contact with a developer before processing. Is it clear till here? What do you think is the most common cause of dark image? Overexposure or overdevelopment? Over? The most common cause of dark image, I'm not asking dark spot, of a dark image is overdevelopment or overexposure. It is overexposure. Excellent. Most of the times, all the students generally say overdevelopment, but it is rather overexposure, because in the developer solution there is a restrainer called as potassium bromide that is present. This potassium bromide ensures that there is no developing that is going on and on. So most of the causes of dark radiograph are caused by exposure rather than over. So is it clear? Film fog. This is how a film fog generally appears as. Can you see this? This is giving a very foggy kind of appearance, isn't it? You can't really visualize how this appears as. So there are lots of causes of film fog. Okay. So film fog is produced due to which of the following reasons. So think logically, what could be a reason? Film fog is produced due to overdevelopment, contaminated solution, fingerprint contamination, overfixing, deteriorated film, or underexposure. Remember one thing, any contaminated solution would result in film fog. Any outdated film would also cause film fog. So I've given you a couple of hints. So what is the answer now? Contaminated solutions lead to film fog. Could it be B? What is choice B? Overdevelopment. Yes, overdevelopment can lead to film fog. What about overfixing? Will it lead to a film fog? No? Okay, let us go back. Improper safe lighting condition. Reasons of film fog. inadequate safe lighting conditions, light leakage, overdevelopment. Remember, you had written overdevelopment, contaminated solution, deteriorated film, in which the reason is outdated film. Okay, so the correct answer would be choices: overdevelopment, contaminated solution, deteriorated film. Okay, is it clear then?
Yeah.
Is it clear? Doc? Yeah. What do you think this is? This is an example. This entire area is in radiographic film, but only this area has come. This is an example of partial image. Okay, this is an example of partial image. Okay, and what is the most common cause of partial image? Well, your cone cut is generally called as a partial image. The cone cut which you generally use in your day-to-day language is an example of a partial image. So this is the next question now. Minimum half layer value for the X-ray tube is it is 1.5 mm of aluminum, and this is this. Can you see the slide in front of you? Well, there are certain things you need to cram it up, and this is one of the few things. In this, you need to know at 70 kVp there is 1.5 mm of aluminum, and as it keeps on increasing 71, 80, 90, 100, the amount of the thickness of aluminum keeps on increasing. Is it clear? Should I change the slide? Yes or no? Okay. Structure seen in transpharyngeal projection is well, this is a transpharyngeal projection now. So what do you think, which pole would be seen in this? It will be the medial aspect of the condyle. Can you see the following slide in front of you? You can easily make out. For your help, I have even put up this slide in which the diagram of condyle and coronoid has been drawn on the patient. Can you see this? And the X-ray machine is placed over here, and we are able to visualize like this. So the medial part of the condyle, the medial pole of the condyle is very clearly visualized or imagined in patients with transpharyngeal view. Okay, is it clear? Is it clear? This is how a transcranial view appears as. Remember three transpharyngeal, transcranial, and transorbital. So transcranial is completely opposite of transpharyngeal. In transpharyngeal, what happens is we generally place the film downwards. Can you see this? Whereas in the case of transcranial, we are placing the machine upward at an angle of 25 degrees. So this is how a transcranial view appears as. So which pole of condyle is seen in transcranial? Just imagine transcranial is being placed from here and condyle is present over here. Can you see this? Condyle is present here and we are placed in X-ray machine over here. So which part of condyle is it? This is your condyle. This is the right condyle. Only the top part of the condyle, the superior part of the condyle is visible in this. Okay, the superior part of the condyle is visible in transcranial as well as the lateral pole of the condyle. So transcranial view helps us in imaging two parts of condyle, the superior part and the lateral part, whereas the medial pole of the condyle is seen by transpharyngeal. Is it clear till here? Well, as I told you, transcranial lateral aspect of joint fossa. Remember I told you? Head of condyle, glenoid fossa, or anyway, you don't no need to know this condition of verticular surface and lateral aspect. Okay, this is transorbital. This is transorbital. Transorbital projection is also called as Zimmer view. It is also called as Zimmer view. Okay, so transorbital is also called as Zimmer's view. In Zimmer view, what we take is we place the X-ray tube right in front of the eye, and we are able to visualize the condyle. Which part of condyle is seen? Interior part of the condyle is seen in this. The interior part of condyle is seen in transorbital. Okay, is it clear? Yeah. I was telling you, transorbital, medial pole, lateral pole, and the occluding part of the condyle. So next question, differential diagnosis of a coronoid hyperplasia or so what would be the answer in this? Okay, I'll give you a hint. What does a TMJ generally appear as? A TMJ consists of articular disc, isn't it? An articular disc consists of fibrocartilage. So whatever tumor is going to occur will be either be having its origin from a tumor or will be having its origin either from a bone or from a cartilage. So it most likely tumor will be
Chondroma.
osteochondroma. Okay, which is the most common tumor of the TMJ. It is osteochondroma. So which is the answer in this case now? Other than osteochondroma, definitely osteochondroma is there. In addition to this,
Arthritis.
juvenile arthrosis, nothing happens. Rheumatoid arthritis also nothing happens. Only in case of osteochondroma and osteoma are you able to see a hyperplasia of the coronoid bone. Is it clear? So both the types we are able to visualize. Is it clear? So this is the next question. TMJ disc can be visualized by, we have the four options right there in front of us. Arthrography, conventional radiograph, tomography, MRI. MRI obviously is the best answer, but what about tomography? Tomography will not help us in visualizing articular disc. What about conventional radiograph? Again, no. But what about arthrography? In arthrography, we are able to visualize
Articular
the
disc.
articular disc. How? Indirectly. How indirectly? Because we are able to place a contrast media in superior place, another contrast media in inferior place, and in the middle, the articular disc is left. And that is what is called as articular disc. Is it clear now? So, temporomandibular disc can be visualized by both arthrography as well as by MRI. Is it clear? Okay. Next question, the treatment of sialoliths includes the following. So which will be your best answer? Is ultrasonography used in treatment? Yes or no?
Ultrasonography.
Ultrasonography is not done in the treatment of sialolith. So what is the next best answer? Obviously you do surgical removal of sialolith. And you also do sialogogues, as well as there is a surgical removal of the salivary gland also. So correct answer is choice is number 2, 3 and 4. Okay, so the correct answer is choice C. Okay, is it clear? Okay, are sialoliths more common in parotid gland or submandibular gland?
Submandibular.
Submandibular gland. And sialadenitis is more common in parotid gland or submandibular gland? parotid gland. So these are the two vice versa things which you guys need to remember. Parotid gland, sialodenitis, and sialolith in more in submandibular gland. Okay. 31st, contraindications of sialography are: what is sialography? It is an imaging diagnostic procedure in which we do imaging of salivary glands. Remember, sialography is never ever done in acute infection. It is only done in chronic infection. Okay? What do we do in sialography? Have you looked at all the 7 choices now? What do we do in sialography? We inject a contrast media, isn't it? And which contrast media do we inject?
Iodine.
Iodine containing. So if a patient is allergic to iodine, can we do it? Obviously not, isn't it? And what about how is iodine related to thyroid function test? And iodine is completely related to thyroid function test, as it generally depends on thyroid. So a thyroid gland function test, its results would be altered by the presence of iodine. So choices number: acute infection is contraindicated, known sensitivity is contraindicated, and even the thyroid function tests are also contraindicated. What about any of these other remaining 4 choices? A radio-opaque stone present in the distal part of condyle, in the distal part of the gland, is also contraindicated. Why? Simply because of the reason that if it is sialography is done, it will push the stone further into the gland and it will aggravate the condition. Okay, so choices number 1, 4, 5, and 7 are all are contraindicated. Okay, is it done? Clear? Next question. This is a slightly difficult question. Radiographic procedures commonly employed to study maintenance without problems of dental implants include? Well,
CT.
if a patient is absolutely normal, you will not do CT scan. If a patient is absolutely normal, you will never do CT scan. What will you do?
Periapical.
A periapical radiograph is definitely
Periapical.
required. Okay. So in addition to periapical, which other radiograph will you do? Is cyclometrics required?
Panoramic.
Yes, panoramic. So choices number 3 and 4 are absolutely correct. Is it clear? Are you getting it? So when you see this slide, can you see this? Where my marker is present? 2 minutes away. Okay. I'll just give you a couple of minutes break because the system just requires a bit of maintenance. Just give me a 2 minute break. Okay? 2 minutes break. 2 मिनट करो. क्यों क्या हो गया? चलो मिनिमाइज करना. कैसे बोलूं?